Yes, I know. It's a very strange title, and I agree with you. And I'm quite sure that most of you are very curious about this strange link. So, in my office, there always been this book, The Original Species by Charles Darwin. It was a present many years ago. I don't know why it's there, but it made me think about this. This was Charles Darwin. Was a British, born in 1809, so a long time ago. Was a naturalist, father of the theory of species, evolution by natural selection. Uh, was a son of Robert Darwin. Maybe most of you don't know that he started to study medicine in Edinburgh School of Medicine, but he was not a very good student at that time. So his father was quite disappointed by this. And as it usually happened in that time, he was sent to for an ecclesiastic career. He married Emma Wedgwood. This was the wife of Charles Darwin. And when he was 22 years old, so quite young, he went for an expedition around the world on the ship called Beagle under Captain Robert Fitzroy. There was another naturalist proposed on board, but at the very last time he refused the task, so Darwin went on. This was the ship, and as you can see, at that time, this was a very heroic, I would say, journey around the world. He published the theory of the evolution of species in the book The Origin of Species in 1859. Much of the bigger part of the data was gathered in the Galapagos Islands. The theory is based on three fundamental aspects: reproduction, variation, and selection. He couldn't present his theory in London because he had a problem in the family. So it was presented in this room by the secretary of a scientific society. But it was not easy at the time to say that man comes from monkeys. So this is a paper on a newspaper of that time when he was criticized and draw like a monkey. So Darwin says that evolution of new species is through a gradual accumulation of small random changes. The positive one is favorable to the survival of the individual, with the better mean that the individual can reproduce more easily and thus pass on their characteristics to the descendant. Each species has its own adaptation, through natural selection. So now let's make a play. Let's replace the word species with specialist or specialty. Darwin postulated that specialty that evolved with new positive feature would be able to survive better. These new specialties would have a competitive advantage over others in the constant struggle for survival. Specialties less favored would have a decreased number and would be extinct. Darwin called the process natural selection. The species with new feature and better adapted to a constantly changing environment would fit better and therefore would have a competitive advantage. It's very common, the example of this insect which can be masked by the color of the body. This is a very famous example. In England, there was the revolution by the smoke for the new industry. So there was a butterfly which was white, But when the smoke was so much and the trees became black, this variety, which was black, survived better because the birds were able to find on the black trees the white butterflies, but not the black one. So there are many animals that disappear because they have not this competitive advantage. So let's go back to phlebology. We know that general surgery has developed vascular surgery, general medicine and angiology. We can say radiology has now turned to interventional radiology, but there is also phlebology, which is not an academic specialty, but it's in true life. There are a lot of change in phlebology, economic issues. I don't know about your country. I can speak about my country or Europe. There is a disincentive to use more invasive treatments, control on the use of certain treatments by GP, and economic crisis. So there is a competition among doctors. This is, for instance, it's in Italian, I can translate for you. It's an advertisement on a newspaper of a dentist, I think it's Serbia, that make varicose veins. Very unusual. Another change of phlebology, which demands more technology. We have endovascular treatment. We need to know how to run a duplex examination. We need to know eco-guided treatments. We need to know new technologies and a STEM concept of risk-benefit ratio. So there is a large competition among radiologists, cardiologists, anesthesiologists, everyone who has a good practice in putting catheters inside a vein. And there is reducing demand for other specialties. For instance, at least in Europe, there is a lower demand of open heart surgery. So many cardiac surgeons are starting to do varicose veins and less request of traditional general surgeons. So again, competition. Applying the principle of Darwin to phlebology means to substitute the concept of species to specialty. The species is defined, the validity of this equivalence becomes apparent if we consider that a species is defined of a group of individuals with high degree of similarity, which can reproduce and show impermanent difference with other species. The medical specialty is from a group of doctors with a specific training, which distinguishes it from other group, which has not a complete capital of other specialty. There's also the possibility to reproduce with training program the specialty. Species and specialty are engaged in a constant struggle for survival. In this competition now, the competition is made stronger by changes in the environment in which species specialty have to coexist. The results of this fight will be the development of an increased number of certain species with a contemporary reduction on other that will see a gradual reduction of the number of the individuals. This will bring to an uncontrolled increase of individuals in the well-adapted species specialty and to compete with others with the same goal, the patients. History of medicine is a full example of that demonstrate that only the capacity to adapt without sentimentalism can avoid the extinction of a specialty. What is opposed to this process? Antitrust laws or laws that rule competition, the fact that at least in my country every doctor can perform almost every specialty, and irrational rules at least for the Italian health system, believe me. What phlebology should do for establish itself as a discipline? Acquisition of competence in duplex examination, acquisition of skills in eco-guided treatment, which is mandatory nowadays, incorporate therapeutic innovation, and I would say that phlebology is full of therapeutic innovations. Acquisition of skill and positioning in vein catheter fibers. Acquisition on hemodynamic concept. This is a very important thing. I appreciate very much the talk by Erika Mendoza this morning because we cannot assume that a vein is a vein. Most of the paper published do not differentiate between the different shunts, even the differences between terminal and pre-terminal valve incompetence, and this is crucial because the result cannot be the same if we make a treatment on something on a different thing. The acquisition of advanced competence of compression with stockings and bandages. I would say that the most important part, at least 50% of my practice is based on compression, not on treatment alone. Because every kind of treatment, if it's coupled with a good compression, but we have to know the resting pressure, the walking pressure, or what we are putting on the leg of the patient. Not like this, for instance, or not like this. Acquisition of skills in treatment of lower limb ulcers, and this is coupled with the compression things. Acquisition of skills in treatment of vascular malformations in the lymphatic disease. So, in acquisition of skills in treatment of complication, because it's very important if we have a complication to know how to treat this kind of complication. So only mastering all these skills will bring the competitive advantage to the phlebologist. You can ask about surgical competence. Did you forget about this? Well, this is what's happened in USA in the last year. You can, I think you can imagine which is the surgical treatment. It's the lowest line. You see, in the year 1999, stripping and ligation was 155,000, but in 2013, only a little more than 10,000 operation. If you see sclerotherapy, what's not even present in the records, but in 2013, it was the first treatment in number in the USA for this kind of patients. So surgical skills will be always an advantage, for sure, for the phlebologists, but in many countries, they are no longer considered as mandatory. So how to get skill in phlebology? Documentation and training, experience, supervision, an accreditation system which is lacking, I think, and the role of a phlebological society, I think, is crucial in this, and public and private multidisciplinary centers. Also, super partes guidelines, sometimes they are not really super partes, support to the institutional level to technological advantage and accreditation system. So the development of phlebology as a de facto specialty is an obligatory path. The various aspects of the study and the treatment of the phlebological patient will be in future more and more sophisticated. Only the acquisition of all these skills will give the phlebologist the competitive advantage. So after many years, I can say I understood why this book was always in my office. And this is a phrase, a statement by Darwin that I think is quite interesting if we change the spatial with specialties. So at the end, let me invite you all to sclerotherapy and venous ablation, which is a meeting we have in Italy, in Bologna. It will be in 2 languages, so you don't need to learn Italian if you if you want to come, and we wait for the abstract here. And at the very end, let me thank Professor Fakhri for this invitation. It was really an honor to be here with you. Thank you.